I knew it was purely for me. Like, I love how I feel. I love how I look.
There's a lot of benefits to aesthetic breast surgery. The way that we view ourselves affects our mental health, our happiness.
Well, Dr. Barry Fairchild, hello.
Hi,
So
Valeria.
official.
I know.
So just to give context to our listeners, we've met before. We met through Creator Method, and I started following you. You are a board-certified plastic surgeon.
That is correct.
Right? Yes. Okay, great.
Yes.
I want to make sure that all the important things are put out there at the front. But when I met you at the Creator Method event, I was, first of all, you're so gorgeous. And I started following you on social media. And you are obviously very knowledgeable. And I really wanted to find someone who is a plastic surgeon that I can sit with and ask all the questions that I don't necessarily get answers from, people that I speak to, because everyone is trying to sell something, in different school of thoughts. So I was like, Dr. Barry would be the perfect person. So thank you so much for coming.
Thank you so much for having me. I'm really excited to be here.
I know you flew in and you mentioned you slept for like 2 hours.
That's right.
Is that the plastic surgeon life?
It's so funny that you asked that, because there's this, I trained in both general surgery and plastic surgery. I'm fully trained in both. And during that transition, there's this idea that there's this thing called the plastics life. Like, it's as glamorous as our patients are, right? But it's a lot of hard work. It's a lot of blood, sweat, and tears. And this is just part of the game. I feel like I'm so used to running on not a lot of sleep and a lot of adrenaline and probably more coffee than I need, but that's okay. Here we are.
It is what it is. You show up. You continue to show up.
We show up.
Something that's also amazing to me is the fact that you have a presence on social media. I always tell people it's one thing when you fully do content creation, but when you also have a career like yours, that you have to be so on top of it and make sure you're present and you truly show up every day, and then also maintain a social media presence. That's very impressive.
Thank you.
Type A personality.
That is
all the way.
Correct. That is correct. My husband always says, like, I have 2 speeds, stop and go.
Right.
And if I'm going to do something, we're going.
Okay.
We're going.
So you just mentioned you trained in general surgery. So is that how you started?
So I would say my road to plastic surgery was very nonlinear. And the starting point is probably a point of contingency. But before I pursued medicine, I was an ICU nurse. Before that, I was an ER technician. And I grew up around a lot of medicine. It was something that I was really interested in from a young age, but certain factors made me think twice about whether it was something that I had to have in my life. And I think a lot of surgeons will tell you that don't do surgery unless you literally can't live without it. And when I identified that I couldn't live without it, I never turned back. I was working in the hospital. It was not very long after I started working in the hospital that I decided to apply to medical school. I got in during the first application cycle that I applied, and the rest is kind of history. I chose general surgery because I knew that I was excited about surgery. I feel like surgeons are at their core doctors. You have to, a doctor, the best way that I define a doctor is somebody that takes ultimate accountability for their patients. There's all these different people that have to collaborate to take care of a human being, but the doctor needs to take the accountability for the decisions at the end of the day. And so surgeons are doctors, but then they're also technicians. And the technical aspect has always really spoken to me. I think it's probably a blend between the science and the art that I really love. And that's what drew me to plastic surgery. I was exposed to plastic surgery while I was in general surgery. And then I was like, I got to do it.
So do people choose plastic surgery? I'm trying to understand. Is it the appeal of the income? I mean, I know plastic surgery is it's a great area to get into for doctors? Or is it like for you, was it more the art aspect of it because you're handling people's kind of faces? Like, what was that?
Sure. I think it was multifactorial for
Yeah.
sure. I think that certainly people think that every plastic surgeon is driving their Lamborghinis into the sunset,
Truly,
but
that's
and
what
some
I
of them
see on
are.
TV.
Yeah, some of them are, but it takes a long time to get there. And I think like the non-glamorous side is the 15 years of training where you're kind of scrounging. You know, there were months I ran out of money during training.
Right.
So it can't just be about the money. Something for me, I think that everybody's motivated by different forces. For me, it was at the foundation taking care of people. You know, I'm empathic by nature. That's what drew me to work in healthcare from the beginning. And I like that plastic surgery is highly, highly technical. I think that is something that the general public doesn't really understand, that in plastic surgery, because your work is so apparent, because it's on the surface, it is every millimeter matters. And it's there for everyone to judge.
Yeah.
And so you really have to have an eye, and we call it art, but we have to have an aesthetic eye in order to say that looks good, that looks symmetric, we're ready to complete the surgery. But also the drive to get through the training and to learn the science behind it.
Right. I mean, it's definitely not a instant gratification kind of journey. I can only imagine. I have my own, background with plastic surgery. I shared it before on my social media. When I was 16 years old, my mother took me to a plastic surgeon to get my nose done. And my nose has always been a big issue for me. I couldn't necessarily pinpoint it, but it was in the way I was moving and in the way I was taking photos. Like there was this kind of, I was just very uncomfortable with the way I looked. And thank goodness that I had a mother that recognized it, very Eastern European. She's like, something doesn't like, we fix it, There's no, there's nothing in between. So when I went and got my nose done, it truly changed my life. Now I have kind of different opinions about it as, I got older, I'm 34 now. But it did really change my life. And it did open up doors to me, not because of the way I look, but because the way I carried myself after I fixed it. So I very much acknowledge the power that plastic surgery has. And I know that right now we live at a time where, a lot of people villainize certain different things. With social media especially, there's so many conversations about how damaging it is for younger generations. And I find today, now that I'm a woman, that my nose is a little too small for my face. So I asked Dr. Berry if there's anything that can be done. And she mentioned that you can get it from the cartilage in your own body.
Right. So in order to build structure of the nose, to increase volume or to fill defects, we use cartilage, what we call grafts. The most common place that we get cartilage is from the septum, which usually provides a large volume of cartilage, but in secondary rhinoplasties, it's usually already been used.
Right.
And so when we're talking about revision rhinoplasties, there's a few options for cartilage. Very common is use of cadaver cartilage, which is from somebody who is deceased who will donate their cartilage. And it's been,
how long has it been used? How long has it been that method been used for?
For many years.
Oh, okay. So it's nothing new.
It's not new. It's not new. So that's one option. And it's nice because it's off the shelf. It's ready to go, right? You just pull it off the shelf and you cut it up and there's an endless supply.
Yeah.
And you're not going to reject it because it's all been prepared. So it's safe to place in somebody else's body. The alternative is using rib cartilage. And the reason people don't like using rib cartilage, which I can tell by the expression on your face, is because it's invasive.
Right.
You have to make an incision, go down, remove the cartilage, and it's more painful and it's more
Well, then you have to heal here
It's-
and here.
Correct.
Okay.
So those are the options for if you don't have septal cartilage left, where we would get it from.
Damn. I was hoping it'd be like, we can buy this little plastic in the
Right.
market and just place it.
So actually, in some countries, they will put like silicone in the nose, but
Right.
the complication rates are
Hi.
very high, extrusion and infection. And it's just, I don't think anyone in the United States does it. Maybe you could find somebody too, but
Okay,
not
now it
recommended.
makes sense to me because I've been looking at certain people's like nose jobs or like revisions specifically. I said, how can you grow a nose again? I don't understand.
Right.
So that makes sense.
Right.
You go to the market.
You go to the market, you just pull it off the shelf.
And that's where I wanted to dive into kind of the social media impact on what you do for a living, on plastic surgery. Based on what you see, the conversations that are going on, where do you feel the message is getting lost?
I think that social media in general can be really overwhelming for everybody. And no matter what we're talking about, whether it's plastic surgery or fashion or lifestyle or eating, that you see a snapshot of reality. You see what somebody wants to put forward, and that can be really confusing for the consumer. So I think that social media is great because it provides so much information in such a short amount of time, but I think it has to be taken with a grain of salt because it's not comprehensive information. And that's why I think you have to, at the end of the day, acknowledge that plastic surgery is surgery. Surgery is always a big deal, and we should treat it like it's a big deal. It's not right for everyone, and it takes a lot of preoperative preparation from a physical standpoint, a mental, a social, a psychological standpoint. All of those parameters need to be addressed before somebody is fit to undergo an elective operation. So I think seeking out a surgeon that can delineate goals that your goals are in line with, and then somebody that's going to be there with you through the recovery process. Because I think one of the things that we don't talk about, and that I've tried to talk about myself on social media, on my platform, is that the recovery process in plastic surgery is not always linear, and that it's not always pretty, and that's okay for some people, and for some people it's not. So I think the more information that we gather, the more prepared we can be for something like surgery.
Okay, before we continue, let's talk about one of today's sponsors, Wild. I, at this point, am a deodorant hoarder. I try so many different brands, and really hard to find, for me at least, one that checks all the boxes. Well, Wild has been approved by me. First of all, it's natural, it lasts long, it's not harsh on my skin, which I find that a lot of other deodorants do irritate my skin. And what's really cool is that they have a reusable and refillable cases. So it is totally eco-friendly. So no more tossing out plastics. Every time I change and refill my deodorant, I feel like I'm making a small but yet significant difference. So if I have to point out, the number one thing that really stood out to me was the fact that it was really, really gentle on my skin. Like I mentioned, I had before issues with irritation, and this one doesn't have aluminum, there's no parabens, it's just clean ingredients like shea butter and coconut oil. Okay, if I have to choose my favorite scent, which is a little hard to do, I picked up both, but I would say Ocean Mist smells amazing, and also the coconut and vanilla is truly keeping you fresh. And I wanted to say frisky, but it literally has nothing to do with this. Just keeps you really fresh all day long, even on the busiest and most draining days. What else can you ask from a deodorant? If you want to join me in going wild, pun intended, you can get 20% off your first order. Just head to wearewiled.com/US and use the code WILDValeria20 at checkout or click the link in the episode description. They also have other products to check out like body wash and lip balm. Trust me, you're gonna love it. I guess for me, if I think about back in the day when I was 16 years old and my mother recognized that, I had this issue and we were looking for solutions, it was a long, thoughtful process until we came to the conclusion that, okay, we're gonna go for it. Right. Where today with social media, part of it is that it feels like everyone is having some kind of procedure done, especially now with social media and the transparency it gives into like the stars, right? Like back in the day, we were talking about it earlier, how we used to look at all these Hollywood actresses and starlets and be like, wow, they were born like this. Right. And feel bad about ourselves, where today with social media, we very much realize how much time and money and procedures go into looking that way. So on one hand, I see the positive impact of just us realizing that, what is it they call it? You're not ugly, you're just broke. Right. That phenomenon. Right. But on the negative aspect, when I think about it, it also opens up so much for young girls that maybe didn't even think about that, their nose or their chin or their lips were an issue. Right.
And I think it's certainly a double-edged sword. I think that there's pros and cons to most things in life, and social media and plastic surgery as well.
Like, how do you navigate that? So let's say you have a young patient that comes into your practice. How do you navigate that psychological aspect, honestly, of determining if this person truly needs something and if you're willing to do that work for them?
So if a minor comes to my office seeking cosmetic surgery, there's really very few operations that I'm going to perform on a child. Probably most common being otoplasty, or pinning the ears back, and breast reduction, which can be done at 15, 16 years old. And we have shown over a long period of time that there's both psychologic and physical benefits to the right person having the right operation. That being said, I see my patients throughout the entire preoperative, intraoperative, postoperative course. They all have my cell phone number. I counsel the patients, I counsel the parents, and a lot of it's just a conversation. And I think that it's my job as their physician to determine, are you ready to have this surgery? Is it right for you? And it's an ethical issue. It's my job as their surgeon to say this is the right thing to do. And that's why it's important to identify a surgeon who has your best interest and isn't just offering surgery to everybody, because sometimes it's better to wait. Sometimes I counsel my patients, this is a good time. I think you're ready from, physically ready and emotionally ready, and you have a good support system for healing. And sometimes I recommend steps to take prior to surgery in order to optimize the outcome and the psychological toll it will take to go through healing. I will say that specifically with facial plastic surgery, it will take a toll on your mind. Like there is a psychological change that happens during the healing process. When you see your face swollen, you have this lack of recognition in the mirror that's frightening. And I tell my patients that. I think that when we downplay the recovery process, it's really frightening for people after they've had the surgery. So people I don't try to discourage people from having surgery if they want it.
These are important things to know.
But I think it's important to acknowledge, and sometimes it gives people pause and maybe helps them to determine, who their support systems are, what their motivations for surgery are, and if their motivations are truly in line with the operation that they're seeking.
Have you seen a surge of younger, not even minors, but younger patients coming in, girls in their 20s that are seeking to do all these procedures?
I haven't seen a lot of patients seeking surgery. I mean, I do otoplasty, which is routinely on children. And that is, that's a surgery that I don't think like the number of patients seeking it has changed much.
Yeah.
We do have some molding that can be placed, like it's an ear mold that can be placed on actual infants when their cartilage is still malleable, which has probably decreased the rate of those children seeking out that surgery at an older age. But in general, the younger patients that I'm seeing more frequently in my office are people seeking non-surgical interventions, Botox, fillers, and that's a slippery slope for me.
Okay, tell me about that.
I think that there's a time and a place. I think that we have so much access to injectables that people are overusing them, and we have yet to see the long-term repercussions of what we're doing to people's faces now. I think that there's a very narrow window where an injectable is helpful, is beneficial. I don't think that fillers should be used like in large volumes in the face. It's just not my practice. It's not my aesthetic. And I think that we've seen that they change over time. We used to tell people, 5 years ago, we used to tell people that a filler is going to last a year. And now we have studies that show, and a lot of fillers are placed along deeper tissues, along, the periosteum of the bone, which is deep. And we've seen that those fillers can last 5-10 years. And
they migrate, no?
They migrate. They migrate more likely in superficial areas. So we see a lot of migration in lip filler because it's such a dynamic part of your face. And so because you're always talking, eating, it's more likely to move around. When we place filler deep to augment the chin, the jawline, the cheeks, or the temples, it's less likely to migrate, but because it's on a it's not on a dynamic surface, if that makes sense.
I love the fact that you mentioned that 5 years ago, it was, there was a different school of thought based on what they knew back then, and now it changed. And that's also something that's so important for people to remember. I think we now live and partially because of social media, in a society of instant gratification. We see something that's popping up and it's trending, and we're like, okay, we're going to get this done. No one's asking questions, right? Like, what is it looking like? What are the long-term repercussions? And there is no information. A lot of doctors also don't really offer the fact that we don't know the long-lasting implications. So I wonder how and if it's changing. I know you mentioned that you share it with patients. Do you think that helps for patients to think twice before they go for things?
I do. And I think, in my opinion, I think that the breadth of my practice allows me to tailor what I think is the right intervention for the right patient. So, for example, if in your toolbox there's just fillers and Botox, that's what you're going to offer a patient. And when you have a more robust toolbox, which includes lasers, chemical peels, and a full arsenal of operative interventions, I'm really able to identify what my patient's concerns are and offer or recommend the thing that I think will give them the best outcome and the best longevity. And I think the problem with the way, we have so many injectors, which is a blanket term with absolutely no delineation of what the training is, making money by pushing non-surgical interventions. I think that we can't keep track of the ethics behind it, and it leads to a lot of patients ending up with looks that they're not happy with, looks that they want to dissolve or alter, and I don't even know what the long-term repercussions are at this point.
let's take a quick break and talk about one of today's sponsors, HIYA. Listen, I've gone through my own independent research on the market when it comes to kids' vitamins, and so many of them contain around 2 to 5 grams of sugar, along with other gummy junk and hard to pronounce chemicals. It's literally candy in disguise. And that's why HIYA was created, to be pediatrician-approved superpowered chewable vitamins for kids. What I love about HIYA is the fact that it fills in the most common gaps in our children's diet. Obviously, food is extremely important, but yet the gaps are still there. So this provides the full body nourishment for our kids that also comes with yummy taste, love, and zero sugar. The product is formulated with the help of nutritional experts. So HIYA is pressed with a blend of 12 organic fruits and veggies, then supercharged with 15 essential vitamins and minerals to help support immunity, brain function, concentration, teeth, bones, and so much more. It's non-GMO, vegan, dairy-free, allergy-free, gelatin-free, nut-free, and literally everything else you can imagine. So HIYA is designed for kids 2 and up and sent straight to your door, so you don't have to worry about that. Because as parents, we have just too much to worry about. So thank you, HIYA. It was intended when they created the product, but I have to tell you about like a fun side note about the product is the fact that the bottle comes with a bunch of decorating stickers, and you get it when you first order, and the kids loved it. So if I can get a multivitamin that does all the things this does, but also occupies my child, I'm in. Say less. I also recommend checking out their new Kids Probiotic and Nighttime Essentials. We've worked out a special deal with HIYA for their best-selling children's vitamin. You receive 50% off your first order. So to claim this deal, you must go to hiyahealth.com/Valeria. This deal is not available on the regular website. You go to hiyahealth.com/Valeria and get your kids the full body nourishment they need to grow into healthy adults. I don't know what came up for me, what was that called? The threads.
Threads, yeah.
Is that still a thing?
Unfortunately, it's a thing. It is something that a lot of people seek out, and I've
seen some horror videos.
I've seen some horror in
real
life.
Wow.
And it's not something that I think there's a very specific patient that can benefit from what we call a thread lift, just to give reference to what that is. So a thread lift is a barbed suture. So it's a piece of suture material with barbs sticking out of it, and it's placed underneath the skin, and then you pull it back and the skin sticks to those barbs. The problem is it's fraught with complications, malposition, extrusion, infections, and it's just not a precise technique. And that's why I think of myself as somewhat of a purist. You know, I'm a surgeon, and surgery is controllable. You are able to control what you're doing to, down to the millimeter.
Yeah.
I do very detail-oriented, intricate surgeries. I think on the two ends of the spectrum are facial plastic surgery, where millimeters make a lot of difference, and microsurgery. So I connect blood vessels under the microscope to provide blood flow to different areas of the body. And so I really, I really value precision.
Yeah.
And I think it's hard to be precise with something like a thread. And also when you have people who aren't as familiar with anatomy as, say, a surgeon is, you are more likely to run into problems. So I've had many patients that have asked me about thread lifts. I have threads in my office, but I'm saying very, very infrequently do I think it's the right treatment for people.
You know what boggles my mind, and it keeps me up at night sometimes, especially in the US, how certain things get approved so fast to be used. You know what I mean? And that not only with, all the non-surgical stuff, but also even with food. You wonder like, wow, someone really rushed to put a stamp of approval on it, and now all these people are using it. And, it takes a few years and we're like, oh, maybe that wasn't a great idea.
Sure.
How do you go about it whenever you get introduced to new things that are coming up?
So everything that we use in medicine and in surgery has to go through a series of trials. And the trials, if you're coming out with a new medication or a new device, trials are very extensive. So I can't speak for food products, but I can say in medicine and in surgery, everything that we do, everything that I do as a board certified plastic surgeon that is very by the book, is I only utilize procedures that have been tested through rigorous randomized controlled trials and approved for safety in humans.
Right.
So that
makes
practice.
sense. I don't know. I wasn't looking for you to be like, they're all evil. They're all after us. Do you feel the way we are promoting plastic surgery, the way it is, right now on social media, and with us knowing that all these people have all these procedures done, has the beauty standards changed? Like, is it harder for us as women to accept aging and like how even our natural faces look like with time?
I don't think so. I think that people have always been getting plastic surgery. They just haven't been talking about it. And I think that you can look at it one of two ways. You can say, well, everyone's talking about their plastic surgery and it's creating unrealistic body standards. Or you can say, well, when I was a kid and I opened a magazine and everyone was perfect, I wondered why I wasn't. And now I know why.
Yeah.
Because I hadn't had plastic surgery.
Yeah. I wonder if there's more pressure on women.
I think there's constantly more pressure on women.
Right.
Nothing new. Right. I mean, I think if it's not plastic surgery, it's hair or makeup or being a mother or being a career woman. I think that the pressure is always there.
It's just another part of the pie, right?
Right.
Okay, I want to talk about certain procedures because we're talking about things that are coming in and out. There's big trends. I remember when I came to Miami, I went to a random mall for something, and I saw just an influx of women wearing those garters or whatever. And it's for the BBL thing. I didn't know it was a thing. So there is like a hospital right beside that mall with a hotel, and all these people come in to do the surgery and stay there for recovery.
Right.
And I was so intrigued. I started Googling like, what is the BBL? And apparently it's one of the most dangerous procedures. So my question is like something like that is known to be very dangerous. How do you navigate as a surgeon? Like, how do you navigate it? I know you don't do BBLs.
Right.
But how does a procedure like that even get to become such a huge thing?
It's a trend, right? And I think that with the body standards are constantly changing. And I think maybe about 10 years ago, we saw people that were shaped like Kardashians, and people started to identify that that's how they wanted to look. They wanted teeny, teeny waists and large bottoms. And so there's two options to get that look. Number one would be liposuction of the waistline with what we call fat transfer, which is a BBL, Brazilian butt lift, fat transfer to the buttocks. And then there's a butt implant, which is less commonly performed because of rates of infection and extrusion. There are some surgeons who do it and do it well, but those are the two options.
I heard that in the US, they actually put a limit of how many of the surgeries you can do
for BBL
per year. Yeah.
There are, because there's been, in the media, we've seen deaths from Brazilian butt lifts. And the reason that happens from the pathologic reason is injection of fat into the bloodstream. And when you introduce a fat molecule is large and it can occlude the flow of blood. So the way that I trained is that you can mitigate the risk of a Brazilian butt lift by injecting the fat into the subcutaneous, just the fat tissue of the butt. The problem is that a lot of people and a lot of surgeons feel that the results are superior if you inject it into the muscle because the fat is placed deeper, so it looks more natural. That's where those large gluteal blood vessels lie, and so that's when it becomes quite dangerous. So I think, we've, again, mitigated that risk as a group, plastic surgeons, by performing Brazilian butt lifts with ultrasound guidance. So using an ultrasound and injecting the fat while you're watching the plane that the fat is being injected into. So there's a lot of safe surgeons who will inject fat under ultrasound guidance, and that's how they make sure that they're not injecting into the muscle and that they're not having that high risk of an inadvertent injection into a blood vessel, which is how people have died.
You really need to want it.
You need
to
to
go
want
through something like that.
There's a lot of people who really want it, but I think it's phasing out.
Yeah, you see it? Do you see any procedures that people used to come in a lot for and now it's kind of dying down, aside from BBLs?
So I've seen a shift in breast augmentation size. So breast augmentation is one of the most popular procedures that all plastic surgeons do, that I do. But the aesthetic of the breast has evolved and changed over time. And I'm seeing a lot more people seeking out a more athletic or small implant just to give them that did she, didn't she sort of look, make them feel more confident in clothing, but not necessarily look augmented.
What are your thoughts about, because that's something that's been trending a lot lately, the whole explant talk. Where do you stand on that?
So explant, just for background, explant of a breast implant is removing a breast implant. And the reason people are seeking removal of their implants is a lot of time for something called breast implant illness, or BII. Breast implant illness is one of those kind of bucket terms. It's a diagnosis of exclusion. That means that we have to rule out all medical causes before we can say, yes, you have breast implant illness, because the symptoms are very vague. Fatigue, malaise, rashes, brain fog, joint pain, things that may be related to a rheumatologic disorder or some other medical illness. So I think that some people do have breast implant illness, but I think it's, again, multifactorial. I think that, I see a much greater number of women who love their breast implants, never have any issues with them, but then there's outliers, and it's probably a combination of how the implant was placed and their genetics. The one thing I cannot control as a plastic surgeon is someone's genetics. And when you introduce a foreign body, if your immune system says no way, then there's just nothing that I can do to stop that process. And I have several women who have sought out removal of their breast implants and feel an immediate relief of their symptoms. So I have to acknowledge that and say that breast implants are just not for everyone.
Yeah. I wonder if that's going to be part of the future of being able to test patients genetically.
That's a fabulous question.
Is that already happening or in the works?
I'm not doing that study, but it's something that certainly as a group, we would love to be able to offer our patients. When I was in training, I did research at MD Anderson. It's one of the major cancer hospitals in the world. And I was one of the research residents, and I created a database looking at breast implant associated anaplastic large cell lymphoma, which is ALCL. You may have heard of the term. It's a lymphoma that's been tied to breast implants. And from that research, I looked at this database. It's an extremely, extremely rare disease. When I was collecting patients, I think I had 50 in the database, and there were 300 worldwide. That was maybe 6 years ago. So, but I know the number is still very, very small. But our data show that a lot of it is driven by it's an immune system issue that's related to genetics. So you have to have all of these factors that line up in order to develop that illness. And I think, we're constantly trying to figure out what are those genetic markers to prevent patients from having bad outcomes. We do that in breast surgery, breast oncologic surgery. There's a huge genetic testing is something that has advanced immensely over the last 5 or 10 years. And I think that's, why there's been early identification of breast cancer, and just knowing that there's a family history gives us pause and tells us that we need to look sooner before things get to the point that they can't be treated.
Very interesting. I'm just thinking about because I got my breast done after my third maxi. It was about, I would say, 4 or 5 years ago.
Okay.
And for me, it was, again, something that I wanted to get my breasts before kids. I was just like, what? I'm ready. And I did go for a very small size, and I'm extremely happy with them. But when I started listening to all these explant stories, because again, once something is a trend, it's like everywhere. And I'm like, is this a sign? Is this trying to tell me something? It's very, very scary. And, we do live in a time where fear-mongering is, its own industry. So I was really worried about it. But thinking back to it now, I did have a lot of tests done. Like I got a mammogram. I got like all these things that were done before I went into surgery. So
just to offer you peace of mind, most women do great with breast implants, and certainly it's easy to let your mind run away with itself when you're looking at all of these stories online.
Yeah.
And I think that you have to take it with a grain of salt. I always tell my patients, if it's not broke, we're not going to fix it.
Right.
If you're happy, if you don't have symptoms, then it's successful. And if things change, then we reconvene. But I don't think that this idea of just instilling fear in everybody is appropriate, because there's a lot of benefits to aesthetic breast surgery. There's
like what? I mean, I know what it is for me.
Enhanced self-esteem. And I think that so much of our success and happiness is tied to our mental health. And it affects the way that we view ourselves, affects our mental health, our happiness. And I'm not saying that everybody should, if you have breast implants, you're going to be happy, but it's part of the equation. I think the way that you view yourself.
I guess it depends also what is the source of it, right? Because yes, there's obviously a case to women that are going to get these procedures done because of the pressure, because what they are seeing happening in society, and who's, 10 years ago, the Kardashians was the ultimate body. So a lot of girls were very impressionable, went to get that kind of body. Today, something different. I do think that there needs to be some kind of like psychological evaluation, before women, girls come in and want to get things done, just to even understand what is the goal, like what are they trying to heal. For me, with my breast augmentation, I knew it was purely for me. Like I love how I feel, I love how I look, and it's just I removed something that I was unhappy about, and now I have more space for other things, in my head.
Right.
And there's a big case for that for a lot of my friends. They did the mommy makeovers and whatever it is that they gone through, they live a much more fulfilled life because that's not something that constantly occupies their minds. But not a lot of people that go into these surgeries are coming from that place. A lot of it is truly like the influence of what's around them.
I love that you said that this is something that you did for you, because that's probably the number one advice that I give to my patients or people seeking plastic surgery, is that you should always undergo surgery or consider undergoing surgery if the motivation comes from within. Outside sources pushing somebody to alter their body typically doesn't go well. I've received the question a lot, what's the difference between an augmentation versus a lift, which we call mastopexy? And if somebody doesn't want an implant, what are their options? And we are constantly evolving, constantly pushing the envelope and trying to offer numerous treatments to our patient with higher, better outcomes and higher safety profiles. So just as a baseline, the difference between, a breast augmentation is to add volume, as the name implies. It's an augmentation, but it doesn't change the footprint of the breast or where the nipple and areola lies. If we need to move the breast mound or the nipple areola complex, then you would require a lift. And there's several different ways to perform a lift, but it's always going to be a bigger incision than you would have with an augmentation alone. Some of the things that, alternatives to augmentation with an implant that I'm having more patients, especially as there's more patients concerned about breast implant illness or who have symptoms of breast implant illness and want implants removed, but don't want to go back to having very little breast tissue. What are the options that I have for them? So there's really two main options. Number one is fat grafting. Similar,
which is huge now.
Which is huge. And it's similar in concept to a BBL. But it's in the breast, and there's some key differences. Number one, when we're talking about safety profile, we're not injecting into the muscle. The pectoralis muscle is the muscle of the chest. We're not injecting into that muscle. We're injecting strictly into the breast tissue, so the safety profile is higher. There is, however, a defined limit to the amount of fat that we can inject into a breast. It's usually somewhere between 200 and 300 cc's, which seems like a lot, but the key variable is that not all fat takes. What does that mean? 50 to 80% of what I inject will stay long term. So it's somewhat variable. So even if I inject 200 cc's of fat into a breast, my patient might only end up with 100 once they're finally healed. Another pretty controversial, very probably not talked about at all because not a lot of people are doing it, is what we call free tissue transfer for breast augmentation. So in my practice, I do a lot of breast reconstruction in addition to aesthetic surgery. My practice primarily consists of facial aesthetics and a lot of breast surgery. And the breast surgery that I do, some of it's functional, like a breast reduction, some of it's aesthetic, lifts and augmentations. And then a lot of it is reconstructive after mastectomy for breast cancer. And when you're recreating an entire breast, you need a lot of tissue. And so the most common surgery that I'm performing, if somebody doesn't want an implant or they're not a good candidate or they want their own tissue that moves and feels like them when they just have, truly just skin over that new breast mound, is something that's called a flap. A flap is removal of tissue from one area of the body with a blood vessel that gets sewn under the microscope to another blood vessel to provide blood flow. And so oftentimes, about once a week, sometimes twice a week, I'm doing one tomorrow. I do something called a deep flap where I take the belly tissue, like a traditional abdominoplasty, a tummy tuck. I take half of that tissue and I transplant it up to one chest, and then half the tissue and transplant it up to the other chest, and then sew those blood vessels under the microscope to recreate the breast mound. And we love this surgery because it's your own tissue, the longevity and the satisfaction rates in our cancer patients is very, very high. So we really try to retain the ability to offer this to our patients. So that's the background. And now a few surgeons in the United States and the world are offering this for aesthetic reasons. One of those practices is the practice that I am with, my Houston surgeons in Houston, Texas. And this technique was pioneered by one of my partners, Sean Boutros. And so it's something that we're doing in our practice and is really exciting, but people take a lot of pause because it is what's traditionally been thought of as a very invasive, large surgery
Right.
for a cosmetic purpose.
Wow, my mind is blown. But I can also, I'm when you said like you attaching, sewing the blood vessel, that's crazy.
Right. And so, and this is a, it in patients who have true breast implant illness
Yeah.
or,
But you're saying that now it's getting done for
an augmentation. So
Right.
we're taking out the implants and recreating the breast with their own belly tissue. So they get a
Wow.
tummy tuck, and then that tissue gets, is the replacement for the implant.
And do you have to, because when you put implants, you have to change them every 10 years, right?
Correct.
Is that something that you have to do with that procedure?
No, it's a lifetime procedure.
So
And
you do
that's-
it once and that's it.
Correct.
Wow.
And
that is very big.
it's huge, and it's your own tissue, so you don't have the risks such as that come with any implantable device: capsular contracture, malposition, rupture. Obviously, that there's downsides to implants, and you don't have those when you're moving your own tissue around. I will say, just because you mentioned it, the every 10-year swap out is not necessarily something that we as plastic surgeons live and die by.
Oh,
I think
really?
we used to tell everybody that they had to have their implants changed every 10 years. And the current recommendation is to undergo an MRI 3 years after you have an implant placed.
Yeah.
And then every 2 years after that to look for rupture. And if you don't have a problem with your implant, if you don't have capsular contracture and you don't have rupture, then we don't exchange them. The average onset for breast implant associated ALCL is 9 years. And that's an incredibly long period after an implant is placed. And the first signs of this lymphoma is a seroma around the implant. A seroma is a collection of fluid. And so all of a sudden, somebody would have a giant breast because of what we call a delayed seroma. And that prompts testing of that fluid. And then we test that fluid for markers that are tied to lymphomas. And if those are positive, then the treatment is removal of the implants with a complete capsulectomy.
And then recalling it.
And then they're pulled off the market. So we are not recalling the implants that are currently in people. There's a lot of people with textured implants.
Yeah.
And we don't.
So you don't call them to reverse surgery or put something else in?
Correct.
So if they don't have any symptoms, you guys are good to go.
Because it's so rare and because it would be thousands, millions.
Yeah.
I'm not sure the exact number of women who have textured implants, but most women don't have problems with them. So it's more if we have that delayed seroma pop up, we test it. If it's positive for those tumor markers, then we treat it. Usually, I encourage people to go to a high volume cancer center to have treatment for something like that because it's, again, rare, and that's where all the research has been done, and that's where they really have the systems in place to treat those patients. I will say it's a very indolent, slow-growing cancer. And so the survival rates that are very, very good if the implants are removed.
The stigma around plastic surgery has been diminishing, which is on the positive side, kind of mass communication that's been happening. People today are very open, very transparent about what they do. And that kind of made it not a big deal. Remember when I had my nose done, I used to lie for years that I did my rhinoplasty because I couldn't breathe properly. It was this huge thing. But now everyone is like, yeah,
I did it.
Oh, good. And I think it's great. It's like not a big deal anymore.
I agree. It was interesting. Recently, I shared that I had upper blepharoplasty, eyelid surgery on social media, and I was actually genuinely surprised with the response. And it started with my followers and mostly positive. And then it just turned into this like wastebasket of hate. And it was very surprising, but to each their own.
What do you feel was
I think there's an underlying feeling that people hold that having cosmetic surgery is wrong. I think that some people just really hold true to that belief. And I didn't see it until the post got pushed out to millions of people. And then it really gave me a glimpse, because before that I was like, people accept it and it's more mainstream and people are comfortable with the idea of altering somebody through surgery. And then I saw this whole nother side and I was like, oh, there still are those thoughts out there.
Listen, I myself, if I'm being transparent, I myself battle with it sometimes because on one hand, I had procedures done, but I don't necessarily want to scream and yell about it because I don't want the wrong person to watch it and be like, now I have to do it, right? It's like I carry this feeling of responsibility because, with young girls, you have a daughter.
I have a daughter.
You have a daughter. You know how it is. It's like,
of course,
it's not like certain content is not getting pushed to younger audience. It's crazy out there, right? A young girl goes online and I always think about it, right? What am I saying? What am I putting out there? So I've been very cautious about what I post, but also how I feel about these things. I shared in a podcast that I did with Lauren Boswick, I said, if you would have asked me today if I would have done my nose job at 16, I don't know if I would say yes to it, because I feel like my face wasn't really formed yet. So I would have waited a little bit longer. I would have still done it, but I would have waited a little longer. So I'm always kind of battling with this idea of I'm not against it because I know how it impacted me and it made me feel better about myself. But also, was that just kind of a instant fix that I could have psychologically put in time and effort to fix without altering my appearance? You know what I mean?
Right. It's an interesting question. And, I'd like to hear what you think, if you think the outcome would have been different had you waited, and because a lot of my patients ask me that. They're like, specifically when we're talking about like facial aging procedures, well, what age should I undergo a facelift? What age should I undergo an eyelid lift? And they're like, I'm only 50. Like, should I wait until I'm 60? And it's such a personal choice.
Right.
And I don't set, obviously there's some age limit, but I try not to be super rigid about that window for surgery, with obviously taking safety into consideration is number one. But I think when we say, you should only get a facelift if you're 60 to 65, then people spend a lot of time in that place where every day in the mirror, they're like, I want to fix this, but like, I'm going to do it in 10 years.
Right.
And then it's like this daily struggle with the turtleneck and the hair. And it's, what is the downside to doing it when it bothers you, I guess, is what I constantly try to figure out. And I think it's different for everyone, but I wonder if you would have, what you think you would have gained by waiting with your procedure.
That's a great question. I think that I would just maybe have known a little bit more of like what I wanted. But yeah, I don't know. Again, I think that I would have done it either way. So it's not a question of yes or no. It's more like, would I've asked for something else, right? But with older patients, I honestly, I don't know why you need to wait. I think the bigger question or the bigger conversation that is happening online, at least, is, are women doing it because of societal pressure, right? So, and we talked about it. It's really has to come from within, and the need and want for yourself rather than to appease what the beauty standards are.
Correct.
So in that regard, definitely. But yeah, I'm always I don't know, I'm always thinking about the young girls, how would you go about talking to your daughter about plastic surgery? And once she's going to have social media when she's older and she sees, how people look like, and her coming to you being like, I don't like this and this and this, how would you go about it?
I think it starts now. I mean, my daughter's 2.5. And
it does start now.
It
honestly.
starts now. And I think that the best tool that we can give our daughters, our children, is to build confidence for real things that they accomplish. To build confidence not because of how they look, but because of the type of person that they are, how kind they are, how accomplished they are. And when we are able to build confidence for things that they achieve, I think it reframes the things that they can't control. On the flip side, I don't think that I would ever, obviously I'm a mother and my daughter is perfect and I don't want to change anything about her ever, right? I love every little inch of her. And so as a mother, you're like, no, don't change yourself. Never change. But I have to accept not just her physical appearance, but I have to accept her emotions and her intelligence. And I have to acknowledge that if she's having a thought that something bothers her, that there's maybe some validity to that we need to unpack. And we need to have a real conversation about what bothers her, why it bothers her, and what the goal is with potential physical changes.
Which I respect my mother so much for doing what she did, because she got a lot of mixed opinions, obviously, when we did the procedure. And it was a big step for us, for her to do something like that. But we sat down and we had the conversation, and it was actually after I started already modeling, and I shot this big campaign, and she looked at the photos and she's like, you're always doing, you're putting your head up and you're kind of covering your face, and what's going on? And I told her, I'm like, I don't know how to deal with my nose. It doesn't match the rest of my face. And she took action. And back then it wasn't common. Now I feel like it's even more frowned upon, honestly, if a mother takes her daughter to get a surgery. But I appreciate the fact that she saw something that shouldn't take that much energy in my life, especially in those formative years.
Right.
Where you can focus on things like intelligence and all these other things.
And things like that. And I think, obviously, like, your mom took it seriously and was action-oriented. And I love that. I think that that's important. She listened to your concerns and she addressed them. Certainly, there's a limit, and parents shouldn't just be like, oh, number one, we should never give our children everything they want.
No.
Because they usually don't understand.
Listen, I wanted a tattoo. I wanted, what is it, the tramp stamp that Brittany had.
Aren't you glad you didn't get one?
Oh my God. No, piercings, tattoos, all of that. My mother's like, absolutely not.
Absolutely not. Right. And that's your job as a parent, to take that information and then set limits that are safe for your child. And I like to think that I'll be able to do that. Certainly, it's intimidating. It's intimidating thinking about, any major decision with your child. And we just take a leap of faith and hope we do a good job with it.
But I feel like you're also very practical, because it's something that you do and you understand, kind of the background. There's no this emotional, there's obviously the emotional aspect because you're also a mother, but you are able to understand
absolutely
how to navigate that.
And I think the biggest thing with surgery, some insight that I would have to provide to my family or my daughter and hopefully my patients, is that surgery is not perfection. That there's this underlying idea that if you have surgery, you're going to look perfect. And recalibrating those expectations is so important, because if you go into surgery expecting perfection, you're going to be disappointed 100% of the time. And usually if somebody wants perfection, there's something else driving that feeling. There's something else missing. There's some piece of the puzzle that we haven't addressed. And no matter how much they alter the way that they look, they're not going to find that fulfillment that they're looking for.
You see, this is what I'm talking about, the psychological evaluation per patient.
I totally agree.
Right?
I totally agree.
So you're basically also a therapist.
I think I am. At my practice, I'm in a group practice, and we are starting to provide patients with resources for mental health.
That's brilliant.
In the perioperative period, because I really do provide a lot of mental health services, and there's a limit to how much I can do, and I'm very transparent, with my patients, that I give them my cell phone number, and most people don't abuse that. It's for emergencies, but I think that having somebody that's not your surgeon that you can rely on and that you can lean on as your body, as your face changes, as you swelling and bruising takes a toll on your mental health. And so I think we've started to catch on to that. You're right, 100%.
Like the pre-operation, to understand the kind of reason and the goal, and then the post-operation when you start seeing all the changes that are happening. And I'm sure it comes with a lot of anxiety and stress.
Correct.
That's brilliant. So you see, this is what I love. I think it's important to have these conversations because, again, we have such there's no nuance to the conversations online, right? It's either bad or it's good. Right. There's nothing in between. And to me, plastic surgery was the kind of thing, like I mentioned, I'm on the fence on, but I love and hope to see that the future of it looks like that, where you're able to provide that mental health support, getting to understand the goal of the patients and supporting them throughout, because it's not, to your points, there's always something deeper than just, how it looks on the outside.
Correct.
Wow. Yeah. I think we just cracked the code. Okay, Dr. Berry, thank you so much for joining me. This was, I love this conversation, honestly, because like I mentioned before, it wasn't this, it's either bad or it's good. There's nuance to it. And I appreciate your time and for sharing your expertise. I'm excited to come visit you in your practice. And maybe you open an office in Miami.
Maybe that's next.
Just an
Maybe
idea.
That's next. It's been an absolute pleasure. Thank you so much for having me.
Thank you.
I loved this conversation as well.
Thank you. Oh, and you can, where can our listeners find you?
My handle is at Dr. Barry Fairchild on both Instagram and TikTok. And it's Barry with an E. So it's Berry. Fairchild.
Beautiful. Thank you.
You're welcome. Thank you.
Thank you so much for watching this episode. I hope you enjoyed it. Don't miss my newest episode right here. And if you're listening to the podcast on Apple or Spotify, please go and leave a review with your biggest takeaway. I love reading your thoughts. And if you have any suggestions for guests or topics, you can leave them in the comment section. And always remember, you are not alone.